Good morning, guys. I hope we're all sparkly. Gym session done. Just about to run the dogs, but I thought I'd do a quick vid about how life is so unfair. Suck it up, buttercup. Get on with it. Nobody cares. Work harder. We're fans of tough love because that's what you need to hear. There are so many health inequalities. There are too many to mention, but they exist in both the male and female domains when it comes to hormone replacement therapy. Women do not have access to safe and effective HRT, which is why we launched an HRT program. We were inundated with requests from current patients. Can you please apply the same methodology that you apply to me, to my partner? So yeah, we offer testosterone and estradiol injections, and we balance them against each other, and we balance them against progesterone. In my professional opinion, injections are the only way of prescribing safe and effective HRT because you can carefully titrate your dose according to effect. Now, the British Menopause Society will say you don't need to have blood tests, just go on symptoms. What if your periods are as a result of thyroid dysregulation? There are so many things that can be contributing to your negative symptoms. It isn't all going to be menopausal or perimenopausal symptoms. It might be some other pathology. It might obviously highlight you do have massively elevated LH and FSH, which will be indicating, but not necessarily diagnostic, of postmenopause. But if you see that picture and low estradiol, surely, logically, and you've got no periods, it's going to be indicating. And if we treat the perimenopause, surely that's an indication for therapy. Now, again, we don't know where we should be when it comes to numbers, but we do have reference ranges, and reference ranges that apply to the follicular phase, ovulation, and the luteal phase. So our patients like to be within the range of 500 to 1000 picomole per litre when it comes to estradiol, and a free testosterone of 0.03 to 0.05. How do you know this? Through clinical experience. How do you know it's not? How do you not think it might be not safe? Because we carefully monitor our patients and they stay within the reference range, and we know that they don't have any negative symptoms because we speak to them. We perform a physical examination. So it's not rocket science. We know that if the dose is too high, there will be negative sequelae. And again, just raise the dose. Raise the dose. Not realizing that estradiol has a relationship with serotonin and everything down-regulates if it gets too high. Testosterone has a relationship with dopamine, which means, again, eventually it will down-regulate. So it's not all about the feels. Often a lower dose is more effective than a higher dose for this very reason. And again, we've got to monitor things like cardiovascular health, because again, brain, heart, everything. You need to apply a holistic approach to medicine. And fundamentally, the NHS is involved in disease prevention. So they're not particularly interested in the menopause. They should be. Now, there are new guidelines to say that if you're going through the menopause and you receive unfair treatment from your employer, you can be sued. They can sue you, or you can sue them. But you can't sue your doctor for not giving you HRT. You can't sue your doctor for saying, I think you're depressed, so I'm going to give you antidepressants, which have negative sequelae, decreased bone mineral density, when they should be treating the cause, the fundamental cause, which is low estradiol, low testosterone. Again, testosterone. We're not going to give you testosterone unless you've got low libido. Well, obviously, everybody's going to go saying they've got low libido because testosterone is fundamental to normal physiology. Testosterone also converts into estradiol. You have to understand the steroidogenesis pathway. So again, it's about balancing hormones. It's about optimizing hormones. And the NHS isn't particularly interested in that. Again, it's about disease prevention. And it's not really their fault because, again, it's about cure, not prevention. And fundamentally, the model is that. Now, they might talk about prevention and it would be cost effective in the long run, but the NHS is about short-term gains. and the funds are about short-term gains. So again, you're going to be offered a statin with a high cholesterol, when what you should be doing is to be looking to reduce inflammation, to hopefully lower your cholesterol. But again, cholesterol converts into pregnenolone. So you don't want low cholesterol, because then you're going to get low cortisol, low testosterone if you're a man, low estradiol if you're a female, dysregulation of your aldosterone, so blood pressure issues. It's absurd. So yeah, this applies to females as well. But when it comes to men, my word, we are ignored. So suck it up, buttercup, get on with it. Take personal responsibility. If you're lucky enough to be prescribed testosterone replacement therapy under the NHS, you're going to get a substandard therapy, because if you understand pharmacokinetics, you'll understand it doesn't mimic physiology. And the premise behind every therapy should be either to correct a pathology to allow normal physiology to ensue, or mimic normal physiology. And microdosing TRT is the best way of achieving that, because what happens? Your male androgen levels follow a diurnal pattern, day, night, day, night, day, night. But again, the NHS can't do this, because we spend a lot of time with our patients going over their symptoms, performing a physical examination, talking about the benefits and risks of TRT, and then safely demonstrating injection technique so then they can do it at home. The NHS isn't interested about this. They just want you to get out, because if they give you their treatment, you won't have a disease or a sequelae as a result of their treatment. But it's not about you, it's about preventing disease, preventing extra work and harm as a result of letting you run low testosterone and feel grumpy. But they can give you some antidepressants. Yeah, but they can treat symptoms, they don't treat the cause. Again, funds are based on short-term outcomes, not long-term outcomes. So again, you have to take personal responsibility, because ultimately it's yours to take. So you're going to go on the internet and you're going to see these wonderful adverts, muscles, sex, oh, I'm going to be, yeah. A recent clinic has sold out. We had an email from them back in the day when we were fighting with them, and they were saying, we do care about our patients. They've now sold out. They're likely on a retainer and they're going to disappear. All the social media that they were doing before has stopped, funnily enough, because it was a business, it wasn't a medical clinic. Again, I can't highlight how important it is to go to a doctor-led clinic, because hopefully, and I mean hopefully, because again, we all have our agendas. Doctors may not have your best interests at heart. We do. Nothing's changed at the Men's Health Clinic. As I've said before, we started by prescribing as per guidelines. We understood that that was not effective, so we adjusted our model to the model that it is right now. And everything that we do is in your best interests, because there's no, why would I do anything that wasn't in your best interests? And again, sometimes it's tough love. You're going to be told what you need to hear, not what you want to hear, because this is a lifelong therapy. This isn't about acquisitions and then, yeah, whatever, we've got our money, we've got a 6-month contract. How can you have a 6-month contract for a medical condition that, you know, you might not suit or whatever, for whatever reason? This isn't a business. This is a medical clinic. And again, if it's a lifelong therapy, you need to have a level of trust in your prescribing clinician. And that prescribing clinician should lead by example. It's not rocket science, is it, guys? So again, taking the path of least resistance, it's a short-term gain, long-term loss. So raising awareness is incredibly important. And here I am sat in my Land Rover talking to you. I should be in my posh clinic, shouldn't I? And if you've been to clinic, you'll realize it's pretty posh. It's a wonderful experience. You are going to have a VIP service, and you need to have a VIP service because we get patients from all over the world. In the last week, we had 2 patients from Norway, patient from Mauritius. Wow. I'm incredibly humbled, but it's because we're genuine. Everything that we say has meaning and credence behind it. The internet, you can hear anything. They can tell you anything. because there's nobody to challenge it. So if you don't believe me, fine, but I haven't changed over these last years. If you look at our website, it's all about education. It's not sell, sell, sell. If you look at everybody else's websites, it's all sell, sell, sell. TRT can make you normal. TRT can give you that semblance of normality back, because you need it, because there's so much misdirection, so much misinformation, and we're stupid, aren't we? I'm stupid as well. We're all stupid, but we're all trying to be better. That's the point. You don't have to be perfect. Vince Lombardi, in the pursuit of perfection, you might achieve excellence. That's what this is about. This isn't about being perfect all the time. This is about taking responsibility, being accountable for your actions, and not looking to somebody else for answers. Look to somebody else for support to guide you on your journey. But ultimately, it's yours. It's yours to take. So run with it.